Welcome to today's lesson on epiglottitis. In this session, we will dive deep into the intricacies of this fascinating condition, exploring its anatomy and physiology, microbiology, pathophysiology, clinical presentation, diagnostic workup, management strategies, complications, epidemiology, preventive strategies, pediatric considerations, and the latest advances in the field. By the end of this lesson, you will have a comprehensive understanding of epiglottitis, enabling you to confidently diagnose and manage this potentially life-threatening condition. So, let's get started. The upper airway consists of various structures, including the nasopharynx, oropharynx, larynx, and trachea. The epiglottis, a leaf-shaped cartilaginous structure, is located at the base of the tongue. It acts as a protective barrier during swallowing, preventing the aspiration of food and fluids into the lower airway. Additionally, the epiglottis helps maintain airway patency by forming a seal over the glottis during respiration. Any disruption or inflammation of the epiglottis can result in compromised airway function and the development of epiglottitis. Epiglottitis can be caused by bacteria or viruses. Haemophilus influenza type B, Hib, used to be the primary cause, but with the Hib vaccine, its incidence has decreased. Other bacteria, like Streptococcus pneumoniae, Staphylococcus aureus, and Streptococcus pyogenes, can cause epiglottitis. Viruses such as respiratory syncytial virus, influenza virus, and parainfluenza virus can also contribute to its development, especially in children. These infectious agents cause inflammation and swelling of the epiglottis. When the epiglottis is exposed to infectious agents, the immune system is activated, leading to an inflammatory response. Immune cells, such as neutrophils, macrophages, and lymphocytes, infiltrate the affected area. These cells release various inflammatory mediators, including cytokines and chemokines, which further contribute to the swelling and edema of the epiglottis. The resulting inflammation narrows the airway, causing respiratory distress and potentially obstructing the passage of air. Epiglottitis is a serious condition with symptoms including a sore throat, high fever, difficulty swallowing, drooling, and a hoarse voice. Patients may also have respiratory distress. A comprehensive patient history and thorough physical examination are essential for diagnosis and management. In order to confirm a diagnosis of epiglottitis, various investigations are necessary. Direct visualization of the epiglottis using a flexible or rigid laryngoscope is essential, while imaging studies such as X-rays or CT scans may also be conducted. Additionally, microbiological cultures can help identify the specific pathogen responsible. Epiglottitis has similar clinical features to other upper airway conditions. Distinguishing it from croup, foreign body aspiration, peritonsillar abscess, and angioedema is important. Evaluation is necessary for accurate diagnosis and management. Epiglottitis is a medical emergency requiring immediate airway management to ensure adequate oxygenation. Antibiotics should be administered to treat the underlying infection, and supportive care measures should be taken to provide hydration and pain relief to the patient. Epiglottitis can lead to serious complications if not promptly diagnosed and managed. Respiratory failure may occur due to the progressive airway obstruction, necessitating immediate intervention, such as mechanical ventilation. Sepsis, a systemic inflammatory response to infection, can develop and lead to multi-organ dysfunction if left untreated. Although rare, the long-term sequelae of epiglottitis can include airway stenosis, which may require surgical intervention, such as tracheostomy or laryngotracheal reconstruction. Epiglottitis has become less common due to the Hib vaccine. It mainly affected children aged 2 to 7 years, predominantly males. The overall incidence has decreased, impacting older age groups and adults. Risk factors include lack of vaccination, exposure to infected individuals, and certain comorbidities. The Hib vaccine has been successful in reducing Hib-related epiglottitis, emphasizing the importance of immunization. Vaccination plays a crucial role in preventing Haemophilus influenza type B-associated epiglottitis. The Hib vaccine is administered as part of routine childhood immunization schedules, starting at 2 months of age. It provides long-term immunity against invasive Hib disease, including epiglottitis. Immunization programs have proven highly effective in reducing the burden of Hib-related infections, leading to a significant decline in epiglottitis cases worldwide. Public education and awareness campaigns are essential to promote vaccination and ensure maximum coverage. Epiglottitis poses unique challenges in pediatric patients due to their smaller airway diameter and increased risk of rapid deterioration. Careful airway management, with the involvement of an experienced team, is crucial to prevent complications. Pediatric patients may require a higher level of respiratory support, such as early endotracheal intubation, in contrast to adult patients. Close monitoring and frequent reassessment of airway patency and respiratory status are essential. Prompt recognition and intervention are vital to achieve favorable outcomes in pediatric epiglottitis cases. Ongoing research continues to shed light on various aspects of epiglottitis. Exploration of emerging pathogens causing epiglottitis, such as methicillin-resistant Staphylococcus aureus, MRSA, provides valuable insights into changing trends and treatment considerations. Advancements in diagnostic techniques, including rapid molecular tests, may facilitate earlier diagnosis and targeted management. Additionally, novel treatment modalities, such as monoclonal antibodies and immunomodulatory therapies, are being investigated. Continued research endeavors hold promise for further improving the diagnosis, management, and outcomes of patients with epiglottitis. Epiglottitis is a dangerous condition that needs to be recognized, diagnosed, and managed quickly. Healthcare professionals must understand the anatomy, biology, symptoms, and tests associated with epiglottitis to effectively treat patients. Vaccinations and evidence-based treatments can help reduce its impact. Staying informed and embracing new treatments is essential for providing the best care for patients with epiglottitis.